Hello everyone, once again welcome to my Oet channel. So today's video it is about Oet introspection regarding the letter which appeared on the exam of 19 November 2022. So from my students I got the idea that in Arab countries and in India there were different question papers. Anyway, we will see one question paper. It is appeared on it came on in Arab countries. I mean, it's like Dubai, some Saudi Arabia, Qatar, Oman, in these areas. But in India, I hope it is different. So we will see this video in another section. So anyway, we will see the question paper, the case note with patient name Mr. Oliver Mackie. Okay, so actually it was quite easy question, as you know that it's a letter to patient's GP. So this is a non-case letter and it is a straight letter also, but there are some confusion how to write a present medical paragraph. Other than that, nothing is there to write, actually only the points it will concentrate on present medical paragraph. So first we will see the just an overall view of the case note. So here as I mentioned, the patient's name is Mr. Oliver Mackie, aged 75, and the writing task is to update current condition to his patient's GP, family doctor, regarding possible assessment and intervention. So this is the requirement for this case note. Actually, this patient is a known case of cancer, and he had hypophyseal tumor removal in 2020. And thereafter he was noted with the lymph nodes involvement, and he has undergone radiotherapy, chemotherapy, palliative care, everything. And patient was under wife care and community nurse visit. We are the one community health nurse, and he was under, he has been under our nursing service for long time after this surgery. That means from 2020 until now patient is under our nursing service, and we are going regularly twice monthly for the home visit, and he is under wife care also. And in between, patient have some recurrence, some metastasis has noted. There was in 2021 in MRI, there was some brain metastasis, hypertension, and the patient is on some medications. In between, patient had confusion. So this problem has reported to GP, and this management is going on. And recently, this is our case note, recently on 4th January 2022, there was first fall. So patient had fall and wife called GP, and we went there, and there was some laceration and bruises noted in left leg. For that, dressings, everything has done. Patient advised for hospice care, but he refused. Again on 6th, there was another one more fall when transferring the patient to wheelchair, and there was a mild lacerations only in right leg. So again today is 8th January 2022. Again there is another one more fall, and wife called, and we went to patient's home. So we are assessing the patient. There are multiple falls, and patient is in end stage of cancer. Therefore, we suggested hospice care again, but he and his wife resisting for the idea. He's telling that I want to die at home. So this is the scenario is happening in home. So what we did means we have just arranged daily home visits from our service. That means we are continuing daily, not even twice monthly. As well as we have arranged occupational therapy services also for the home appliances and assistive devices to prevent further fall. Then we just discussed again regarding this patient's condition, and the family of course is distressed, and they agreed for GP's consultation. So even wife also getting difficulty to take care husband, because he wakes up 3 to 4 times during night time, and she is getting tired. So these all problems resulted in GP's consultation. The suggestions was agreed by patient and his wife. So we are writing a letter to his GP for further assessment and possible management for hospice care, because in this stage of course patient needs hospice care, but they are resistant until they are resisting for the idea of hospice care. So anyway, we are just hoping that when PGP will come and will talk with the patient of course, he can agree for this hospice care, or he can arrange some other assistive services. So this is the overall case note for this exam. And with this questions, I am not sure about these questions and all. This is from my students. So from this, how we can formulate a letter. So I will give you just a sample letter. I'm not sure about all these content, whether it is exactly the same as exam question, but we will see. Just a small letter, a sample letter. So as usual, we will just start with the date 8 January 2022 and the reader's address, name if it is given, name and address. Then we will write the salutation, dear doctor or doctor name. Then subject Mr Oliver Mackie, aged 75. Then the introduction is, I am writing to update. This is a non-case letter, so we will just write it in that way. I am writing to update you the current health status of Mr Oliver Mackie, who has end stage of cancer and has recurrent falls. He requires further hospice management. So actually here we have to write regarding the end stage of cancer as well as recurrent falls also, because current condition means patient has recurrent falls. This cancer is there for a long time. He is under the care. So from 2020 he is under the care only. So we have to mention these two. So I am writing to update you the current health status of Mr. Oliver Mackie, who has end stage of cancer and has recurrent falls. He requires further hospice management. So this is the requirement and this is the complete introduction. Then we will go to the present medical paragraph. Here we have to just start with the our home visits, what all things it's happened. But even if it is a non-case also, just we can start with our service, how our service has started. So as I mentioned in the earlier videos, even if you are writing like a non-case, you have to just start with as you are aware if you want to write the old history. Okay, actually past history we should not write it in the non-case, but if you want to write like a single sentence, you can start with as you are aware. As you are aware, these all the things happen and he's under our care, like that. Just a reminder only. So you can just start with like this. As you are aware, Mr. Mackie has had cancer metastasis and has been under my nursing care following his surgery since 2020. So if you want to write has had, there should be the year. So from 2020, patient has this problem like cancer problem and metastasis, everything. So you can just write, as you are aware, Mr. Mackie has had cancer metastasis and has been under my nursing care following his surgery since 2020. Then during my visit on 4 January, he had a fall resulted in left leg lacerations and bruises which were managed with the dressing. Okay, so this is the first fall we are mentioning during my visit on 4 January 2022. He had a fall resulted in left leg lacerations and bruises which were managed with the dressings. So just we will continue with also he was recommended for hospice care, but he and his wife were resistant for the idea. So after this fall, actually we recommended for hospice care, but both of them they refused the idea. Subsequently, after 2 days, he had right leg lacerations following his second fall while transferring to wheelchair. So just we are mentioning about the second fall also. Subsequently, we can add one connective. Subsequently, after 2 days, he had right leg lacerations following his second fall while transferring to wheelchair. Then by this we can just close the first paragraph, I mean first present medical paragraph. Then again we can go to the next paragraph. As you know that present medical paragraph we can write it in 2 paragraphs, okay, not more than 2. So the next paragraph can be, we can write regarding today. So here I just want to tell you something. If we have multiple home visits and there is something special thing happened today, means always try to write all past home visits in single paragraph and today's visit in a separate paragraph. So it will be easy for the reader to get a clear idea. So just here also we will write in that way only. So gradually, there also you can say write consequently, subsequently or gradually, whatever. Today, during my visit, Mr. Mackie presented following another one fall and his family is distressed regarding his condition. So this is today's scenario. However, he and his wife still disagreed for hospice care, as well as he desired to spend last moments at home, because he's telling that I want to die at home. So we could not write in that way. So we have to just write in this way only. So gradually today during my visit, Mr. Mackie presented following another fall and his family is distressed regarding his condition. However, he and his wife still disagreed for hospice care, as well as he desired to spend last moments at home. Then In addition, his wife is getting difficulty to take care of him because, he wakes 3 to 4 times during night. So this one also we can write because this is a concern from patient's wife. So in addition, his wife is getting difficulty to take care of him because he wakes 3 to 4 times during night. Therefore, he was arranged with the occupational therapy. So that is what we arranged. He was arranged with occupational therapy for home appliances and daily home visits from my service. So that is what we are just telling to the doctor, that I actually continued my home visits like daily, and I arranged the occupational therapist also. Since he is willing for your expert consultation and immediate attention from your service is essential. Okay, here we can write, maybe we can write however. However, he is willing for your expert consultation. So like that also we can write, however, he is willing for your expert consultation. Thus, an immediate attention from your service is essential. So in that way, we can just conclude the present medical paragraph. So always please try to conclude with something like however or therefore. Something you can use it here. Just sum up what we want. Then the last paragraph will be, it would be appreciated if you could take over the case of Mr. Mackie for urgent assessment and provide further management for his hospice care as you feel appropriate. So in the starting introduction, if you wrote management, here it should be treatment, okay, or interventions you can write. It would be appreciated if you could. This is the phrase what we are using for doctors only. Take over the case and as you feel appropriate. And if there is no specific recommendation, you can use in this way. It would be appreciated if you could take over the case of Mr. Mackie for urgent assessment and provide further interventions for his hospice care as you feel appropriate. Then yours faithfully. If there is a doctor's name, you can write sincerely. If there is no name, you can write yours faithfully, community health nurse. So this is the letter. So just a sample letter. I don't know whether there will be more content in this case note, but with what all the things that I got with that idea, I just wrote one sample letter. So in that way, we can just present, because it is a noun case letter. You have to give concentration mostly in introduction and present medical paragraph. So in introduction, we have to mention about falls as well as regarding the metastasis also. Don't write the tumor, or don't write it's like a simple cancer, because it is a metastasis already. Patient is in end stage. So their hospice care is much important, but we are telling to the patient, but patient is disagreeing for that. That's why we are writing letter to GP. So this is the overall content of the letter. So in this way, we can just sum up the key, because there is no social paragraph, there is no much recommendation sentences also. So you have to just concentrate on this present medical paragraph. So introduction also, you can just mention the hospice care. So this is important. So I hope it is helpful for you, and in next video we will see regarding the case note which presented in India. With that I got some idea regarding the case note. With that, we will do the next introspection. So until then, bye, take care.